She's the strongest person I know.
If I wanted to take a wall down in my house and do something, that's what I would do. I wanted to build something outside, I would literally go do it. Well, it got to the point I didn't do anything.
She's incredible. She's been through terrible times.
I was diagnosed with MS when I was 21.
Obviously, that diagnosis for anybody is heart-wrenching, but she took it in stride. She tells everybody that she has multiple sclerosis. It does not have her.
I started having more problems, just started progressing. Finally, I had to get a new neurologist, and I came to Dr. Kilgo.
It wasn't necessarily the MS that was causing the problem. She was having, structural issues within her back.
She walked at her hips. She slumped over all the time. She didn't drive. She didn't do anything besides lay in bed. She was practically bedridden.
I never went out. It took a toll to the point that I was literally could not pick myself up. I was withdrawn from everything. Friends would call, they would ask to do something, I would figure out an excuse, and I just couldn't do anything. I had no hope at all. My quality of life just deteriorated.
On a normal day for Miss Reeves, she would come into the office. She had some, walking difficulty, and over the years she started complaining of more and more back pain, kind of pain down in her hips, a lot of stiffness and tightness that had really affecting her quality of life. That ultimately led to her to have, surgery somewhere in the area, and not too long after that surgery, within a few months, she came to see me, and she was a different person. She was in, severe pain, just very frustrated with the outcome she had gotten from another location, and was just wondering if there's anything I could do. In terms of my ability to treat that, I know I'm not a surgeon. I know we have a very good and robust comprehensive spinal institute here at USA, and the first person I thought of was Rich Minger.
And she had a pretty significant spinal deformity with a kyphosis, meaning she was bending forward, and she had severe, decline in her quality of life. Immediately impressed by, just her optimistic attitude, her toughness, her grit, just being able to kind of live through that, in meeting her sort of right away, you can tell that she's really an incredible person with a lot of grit and determination. So she had a surgery at an outside hospital, and she had some challenges after that surgery where essentially her spine collapsed forward, which is extremely painful. Not only did her spine sort of shift forward, it also sort of locked or fixed in that position, what makes it a much more, technically demanding surgery to fix. So it's something that's definitely been a severe long-term problem for her following her previous surgery. Immediately upon seeing her, we realized just the profound difficulty and challenge that this problem creates in terms of inability to sit up, stand up, and function. These are fairly large surgeries, so we go through a pretty detailed protocol process to make sure surgery is safe and that we do the right surgery.
I felt comfortable from the word go with him. I felt like it couldn't get any worse than what I was going through.
She was, appropriately apprehensive, right? So she wants to get better. She wants to get her life back under her feet, sort of literally, but definitely, concerned about just the tenacity and the complexity of the surgery.
She was hesitant, obviously, because, who wouldn't be after all she's been through? But, Mama, you gotta do it. I understand how scary it can be, but right now you have no life. Could it go that way? Yes. But you could also have life. Right now, you have no life. We get there early that morning, and we were expecting 8 to 12-hour surgery, and I think it was right at 12 hours.
The 100,000-foot view of spinal deformity surgery is to put people in a natural, normal alignment so that they can live, function. Everybody, the patient, the patient's family is counting on you to, be able to help this patient, right? So it takes as long as it needs to take. So essentially, we have to go in and perform sophisticated carpentry, allowing the spine to move back into the position that we need for her alignment, intentionally breaking the spine in certain areas to allow it to move back to a proper alignment. The challenge in her case is that we had to perform what's called the 3-column osteotomy, which is our most advanced osteotomy type, where we drill and come around the spinal cord, temporarily separating the bone so that we can pull it back into the right position. So it's a pretty technically demanding surgery necessary, because not only was she falling forward, but she was fixed in that position. So for us, that's a rigid, fixed kyphosis that requires a pretty invasive and technically demanding 3-column osteotomy. When we do these spinal deformity surgeries, we take on the risk to the nerves and the spinal cord every time. We know that you have to make a decision, and the reality is you make the wrong decision, there's a risk for paralysis. And that's something we know about, we prepare for, we're ready for, but you have to make the right decision at the right time for each patient. Once we mitigated any risk to the spinal cord, I was very happy with her overall alignment, happy with her post-operative wake-up test, happy with the x-rays and the CT scans. We're very mindful about making sure the patient's in the right alignment, so that when we leave that operating room, we've known that we've done everything possible to put the patient in the right alignment, give them the best quality of life, and make sure their spinal cord is safe.
It's like normal post-operative stuff. She's got a lot of pain, and so we're trying to help manage that. Because of where they operated, they had some swelling afterwards, and she actually had some new motor weakness, right? We were doing all the things we could medically to try to minimize the long-term outcomes of that. What we saw is over the subsequent days, her strength began to gradually improve to where it was almost back to normal strength.
We almost always try to get patients up the next day to test that posture. They might not walk a tremendous amount. We want them up, we want them moving. And that's where we really rely a lot on our physical therapy team, our nursing care. These are the folks that help these patients get across the finish line.
I was walking down the hall within the next day. It was pretty amazing. Standing up. I wasn't bent over.
That was the first time I saw my mom stand up straight in 2 years. After a few days, she was finally moved out of the ICU into a normal room. My babies were able to come see her, and I think that gave her that much more oomph to do what she needed to do to get going.
Between 3 and 4 weeks, I stayed at the hospital, walking with my walker, and the physical therapy would come in, and we would go down the hall for a while.
Very assertively and openly with our patients undergoing these types of surgeries, we tell them it's usually 6 months to a year for a full recovery. We never make people pain-free. That's never our intent. The idea is improving people's quality of life. The first 6 weeks, we tend not to push things too much to make sure the bone gets a chance to heal, and then we start very aggressive therapy. That grit and that tenacity that was immediately obvious on the first visit certainly helped her get the best possible recovery she can, and I think her quality of life is substantially improved, and she's able to function, and we're just really happy with how she's doing. For us as surgeons, when we take on a surgery of this, sort of tenacity, it really takes more than, one person. It's really like the whole system allows us to occur, because we can't do what we do as surgeons and we don't have everybody else.
We've really built up a really great team here at USA. The subspecialty care was really important in this case for Ms. Reeves. When you see a patient really do well, respond really well, they were in a pretty desperate situation, and very rewarding, feels good.
You look back at your life and you're not going to remember some of the smaller things, but you're going to remember that you fundamentally change people's lives, right? So I think that that's the gift that we're able to be given, and the responsibility that we have every day. For us, it kind of makes all those sacrifices that we put to get to this point worthwhile.
They're just incredible. I truly don't have words of appreciation, thanks, gratitude. I'm just so thankful, so incredibly thankful for everybody that helped.
I've been given a new life. Y'all were the most amazing people I've ever met in my life. I appreciate every one of them more than they will ever know.